Hello and welcome to Mommy Dentist and Business Podcast. I am your host, Dr. Grace Yam. Welcome back, listeners. Thank you for being a part of our community. And I have to say the support is tremendous. We have won so many awards year after year, and I feel very grateful. I mean, that is the key word is grateful because without my listeners, I would not be recording and delivering this podcast for 8 years. Now, today I have an amazing speaker and I cannot wait to get to know him better. And I want you all to get to know him better as well. And we want to say thank you to NSK for sponsoring Dr. Nekky Jamal, who is also a dentist and a speaker. So welcome.
Thank you so much, Grace. This is awesome. I'm pumped. I'm excited.
Amazing.
Let's dive into this.
All right. Okay. Well, you know what? I always ask this first question
Let's
because
do it.
we're downloaded in 44 countries and
Nice.
we want our listeners to know you. And if
Sure.
you can give everyone your kind of not a bio or an elevator pitch, but something like a morsel about you, what you do, and how you got to where you are today.
I love it. What up, everyone? My name is Nekky Jamal. I'm a dentist in Alberta, Canada. It's freezing here right now. We got tons of snow, but life is good. Grace, I love what you said about gratitude because that's everything around me revolves around gratitude. I wouldn't be here today without the people around me. And so I don't know. I'm just a general dentist and I have so
No,
much
you're
fun at work.
not. No, you're not. See, whenever someone says I'm just that's their way of downplaying
No,
themselves.
no, no.
And so I'm like, okay, the clue right there was you just you led with justice. So that means alarm bells go off. I'm like, oh, he's a big deal.
No, 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 no. I honestly, I have so much fun. I have a surgical practice. I sedate. Man, let's put it this way. The same kids that I used to coach in basketball are now my patients, and I
Oh,
get to sedate them and take out their wisdom teeth. I'm so privileged to be able to often be at like the person's first doctor, my patient's
yeah.
first surgeon that they get to see. I get to take out their wisdom teeth. It's often their first IV. I'm just so fortunate to be able to shape their view of healthcare and what we can do as dentists. And so I take out wisdom teeth all day. I travel around the world and I teach dentists how to extract teeth safely and efficiently. I actually just got back from Guatemala last week. We were doing
Amazing.
a dental mission trip down there. I've been down to
Cool.
Central America 19 times to do
Wow.
dental care for people that don't have access. I'm a runner. I'm everyone's hype man. I just have fun. I think dentistry is the best profession in the world. I have a really hard time speaking about myself, as you can tell, and I just have fun every day, man. Life is good.
Oh, good. Well, you know what? I have to say, we were just at Whistler. I'm here in
Nice.
Southern California,
Yeah.
but my husband's dual citizen. My mother-in-law's Canadian.
Oh, perfect.
And yeah,
We're family
so
now.
oh, totally. So now when I go up there, I'm gonna have to find you. Alberta's probably even colder than
It's
Whistler.
a little bit colder in Whistler, but we got better steaks out here, so it's good.
Okay. Well, we
Yeah,
do have a lot of mommy dentists in Canada, like
I
a
love
lot.
it.
So
Yeah,
whether it's West Coast or East Coast, like Toronto and Montreal and
yeah.
Vancouver, we've got mommy dentists everywhere. And I think that it's so nice to think that the world is a smaller place when we're doing dentistry. Like the dental world is so small and we're all connected. And I know that your mission is to obviously do oral surgery, but I was thinking that in this podcast, we would talk a little bit more clinically about what you do. And so
Yeah, let's
I
do
was
it.
going to ask you, after an extraction, what can clinicians do to help promote faster and more predictable healing for patients?
Grace, and this is awesome. This is a topic I'm super passionate about because as a dentist, my goal has always been I never want people to feel like getting their wisdom teeth out is akin to losing a limb. Like you
Mm,
go on TikTok, you go on Instagram, you see like my patients are freaked out. Should I be
mm,
drinking pineapple juice?
mhm,
Should I be worried about my wisdom teeth coming out? And patients come in crying because they're so
mm,
nervous, right?
mm, mhm,
And
mhm,
my goal as a dentist has always been, let's just chill out a little bit. Let's
mhm.
make it that wisdom teeth doesn't have to be a big deal. Why
Sure.
do patients have to swell? Like when they come out of their surgery, why do their cheeks have to look like balloons?
Mm,
Why does there have to be so much pain with
mhm,
wisdom teeth? And so it's been my mission as a dentist to
mhm,
reduce post-op pain
mm,
and improve
mhm.
healing. And
Sure.
I have to say the number one way I've been able to do that is through the use of PRF or platelet-rich fibrin.
Okay.
So we take our patient's blood at the same time as we do their surgery. We put it in a
Uh-huh.
centrifuge. We spin it at a certain angle for a certain amount of minutes,
Okay.
and we isolate basically the patient's platelets or their growth
Uh-huh.
factors, which are
Uh,
inside their platelets. I want you to think of
okay.
platelets like little tiny water balloons. And
Okay.
inside those water balloons are all the patient's growth factors. And we
Mhm.
incorporate that back in the surgical site.
Okay.
It improves healing, improves angiogenesis or new blood vessel formation. We
Okay.
have like according to the research, a 96% reduction in dry socket.
Mhm.
My patients heal faster. I honestly don't remember the last time I've seen a dry socket.
Mhm.
And I really feel like that's been such a huge game changer for me.
So that kind of reminds me of medical doctors drawing blood and putting it
Yeah,
into like joints, like tennis
totally.
elbow or like the
Yeah.
shoulder. Is that the same thing what you're doing?
Kind of close. So that's PRP. So that's
Okay.
platelet-rich plasma. So that's an actual liquid you can inject. It's a different spin protocol. We're making platelet-rich fibrin. So I want you to think
Okay.
of platelet-rich fibrin almost like a jelly that we're
Okay.
able. You can't really inject it. It's almost
Uh-huh.
like a jelly, almost like a piece of
Okay.
jelly that is basically the patient's fibrin clot.
Oh
And
my God. Oh my God. Wait, hold on one second. This is triggering memories of dental school. Is this like the fibrin, like clotting factor thingy, like chain
kind
reaction?
of extrinsic, intrinsic factors all coming together. Oh yeah. No. That's absolutely it. We're creating a fibrin clot. And
Okay.
inside that like spider web fibrin clot is
Yeah.
entrapped all of our patients' platelets. And I don't know. I love this stuff. I think it's so
That's
cool. I get to be like
cool.
a mad scientist every
Yeah.
day. I show my patients, they're all
Uh-huh.
grossed out. I'm like, man, it looks like a
They're
little
all
piece of
gross.
sashimi. And they're like,
Ew.
why did you say it looks like food? And
Now I'm not gonna eat sushi.
no,
Oh
no, no.
my gosh.
You're in.
Okay, okay. So do you take this to Guatemala with you?
No. First of
Okay.
all, okay, so I was just in Guatemala. Man, it's crazy. It's like a game of telephone
Okay.
because I speak English and like dental Spanish, but my
Okay.
Spanish is like muy mal, like very bad, like it's horrible, right? And so, but like we go to these communities, these Mayan communities, and
Uh-huh.
we have a translator going from English to Spanish, Spanish to a language called MAM. And so to explain, I'm going to be taking patients' blood. No, it's too,
Hmm. It's
it's
too
too difficult.
complicated.
Man, they
Okay.
have never seen a dentist before. I don't want to scare
Right.
them too much, right?
Right.
Yeah,
Right.
but no, I've been doing it on patients, and I've been teaching it to other dentists for
Okay.
the last 14 years.
Wow.
And it's just been amazing. Like I've done this
Mm-hmm.
on like well over 10,000 people.
Mm-hmm.
It's funny because when patients are referred to me now, they often
Mm-hmm.
just put their hand out, and I was like, "What's going on?" And they're like, "Oh, my dentist
Mm-hmm.
said you can be taking my blood. What kind of dentist
Mm-hmm.
takes my
Mm-hmm.
blood?" And I'm like, "Well, this is why you were referred here. Let's go, baby." And
Okay.
and you show them, and they're like,
Yeah.
"Wow, I can't believe that." And you just show patients that us dentists, we're badasses.
Yeah.
Like we're
Well,
not just dentists. Like
well,
we
you
know how to do
started
it.
with
I know,
that.
I
You
know,
started with that.
I know.
So I have to hit the pause for a second because
Let's
again, my
go.
head is like spinning with ideas and thoughts. So first of all, who in the office is drawing blood? Like, do you have to
Me.
have, are you supposed to have special training in this drawing blood? Like, you're not a phlebotomist. Like, I mean, like,
No.
what?
Those three letters behind my name let me do a little bit more than just mess around with teeth though. So yeah, no, I've taken a course on it. You don't have to
Okay.
be a phlebotomist, but
Okay.
it's encapsulated within your degree and scope that you're allowed to
Okay.
take blood. Yeah.
Okay. Okay. So general dentists are allowed to take blood.
Heck yeah. Yeah.
Okay. All right. Well, that was, we need to get over that hump first. Okay. So we
Yeah.
got
Yeah.
over
Yeah.
that hump. And then are you sending your patients before you draw their blood to go get blood work to see what kind of blood they have and what you're going to get out of centrifuging and making
For
sure
sure.
obviously, you know, that you don't want a hemophiliac in your chair and you, but are we doing a full panel is what I'm asking.
No, I'm not doing a full panel. I'm not too
Okay.
interested in their blood type,
Okay.
or what's in there. I'm more concerned about their platelets. I just want their platelets, and because inside those platelets are the growth factors, right?
Right.
And so if a patient is on anticoagulants,
Right.
then it's much more difficult to form that fibrin clot.
Right.
But
Right.
also, it also gives you insight into the patient. So, like,
Sure.
say I go to spin someone's blood and I can't make a fibrin clot.
Hmm.
Do you think that patient is going to be able to make their own clot after I pull
Right.
their tooth? And
Right.
so I use it, it's little tidbits like that that
Yeah.
help give us more information. But no, I'm
Yeah.
not sending my patient for a blood panel prior.
Okay.
Yeah, I do PRF probably like today. I had a full day at work. I probably did it like maybe 15, 17 times.
Oh,
I do it on every patient. I just
okay.
find I don't have post-ops. And
Okay.
if we can improve angiogenesis or new blood vessel formation in surgical sites, why wouldn't you want that? And if I had a tooth pulled, there's no way in heck I would ever get a tooth pulled and just someone throw gel foam in your socket. Gel foam
Hmm.
delays healing. It does
Hmm.
nothing.
Yeah, you're
You're
just
making,
packing in the,
yeah,
yeah.
man, why do people put gel foam in sockets? Why do dentists do that? They do
I
that
don't
for
know.
us. They do it for us
I
because
don't
then
know.
we feel better. We got to do something, right? We
Okay.
want you to do better. So I'm just going to put this sponge in here. It's going to delay healing. I paid
Well,
20
wouldn't
bucks for it.
sutures be better than a sponge?
You still have a hole though.
You're closing,
Yeah.
you're like putting the
If
cons
there's a erupted tooth there, in order to physically close the site, you'd have to be pulling the gums pretty hard, and you'd have a lot of inflammation if you did that because
Okay.
you'd have to make an incision in the periosteum to be able to close it all the way. I don't
Okay.
recommend you do that unless you absolutely
Okay.
have to, if there's an oral antral communication or something like that. But in an everyday extraction of a lower first molar, no, you're not going to be getting primary closure there.
Okay. Well, I treat children as a
Okay,
pediatric dentist, so I don't really have that
nice.
much experience with like the type of work you're doing because we just send them to
Hey, vice versa, man.
you.
I saw a kid today for the first time in, I don't know, a couple of years. And I walked in, gave this kid a fist bump, and I'm like, man, I should start seeing more kids again. And then he opened
Oh,
his mouth and
yeah.
started crying. And I was like,
Oh.
nope, I'm out. I'm out. I'm out.
Oh. Well, I mean, we'll have to come to that, you know, I'll have to save this part for later because I need to get on to the next question. So, my next question though is for post-operative pain management.
Yeah,
And I've taken a few courses on this about
let's
pain
go. Yeah.
management, but what analgesics are you finding to be most effective, and how are you deciding what to offer or prescribe if need be?
You know, Grace, that's an interesting point that you bring up. I find all dentists are different, and patients sometimes play a role in what we give them as well. Um, in my practice, I take out teeth all day. That's kind of all I do. And the only, I'd say 99 times out of 100, my patients are getting a combination of ibuprofen and acetaminophen.
Hmm.
In Canada, I don't know what it is like in California. In order to give an opioid, we need to give a triplicate prescription pad. And one copy goes to the government, one copy goes to the pharmacy, and then you keep one copy. So we need a special book in
Hmm.
order to write a prescription. I
Hmm.
ordered my triplicate prescription book in 2009, and I
Hmm.
swear in 2010 I had a sketchy patient. He stole my book. I don't know. I'm just kidding, but
Oh, okay.
I
It's
couldn't
like,
find it. I
oh.
couldn't find it. I've yet to write an opioid prescription
Hmm.
in the last since 2010, I guess.
Yeah.
We just don't do it. You
Well,
don't
that's
need it.
good. That's good to know because all the courses I'm taking is saying the same thing. Because
Yeah,
with the
you don't need it.
opioid epidemic, they're
Yeah,
saying surgeons should not prescribe opioids. Like they should do the acetaminophen ibuprofen combo
yeah. So Grace,
alternate.
here's the thing, okay? Do you, in your opinion, okay? I'll tell you what I do after you tell me what you do. Do
Okay.
you give ibuprofen and acetaminophen at the same time? or do
No.
you stagger them?
I stagger them, but I do start with, well, with kids, just say start with acetaminophen. So that's what I say to start with.
Hmm. Yeah, no, that's cool. I stagger them as well. The research shows though, if you give them together, you have better breakthrough pain relief.
Hmm.
I always start with ibuprofen because it's an anti-inflammatory as well. You don't get the same anti-inflammatory benefits with acetaminophen, but I'm working on patients over the age of 14 to 15.
Yeah.
So that's what I do in my office. But now let's take it up a notch. What if you have a patient that calls you? And it's day 4 of their
Hmm.
extraction. They're like, Nekky, man, what did you do to me? It hurts so much.
Hmm.
I'm just finding I'm not getting the same pain relief. So what's the
Hmm.
next step up?
Well,
Because
then you should
that's
take
what you
both
got to
at the
know.
same
You
time.
take both at the same time, but what else? What else could you do? What's the next step up? What would you do?
I would say, well, I would ask, like, what are they eating? Like, I would want to
Yeah,
know, like, what, are they aggravating it by chomping
totally.
on something? Like, what are you brushing to? Like, what else could they possibly be doing to exercise, like, make it worse, the pain worse, right? And
Yeah.
then I would ask, like, you know, what else are you taking besides those two medications?
Yeah. No, and that's totally cool because I get this call. You'll always have the odd person that Advil and Tylenol or ibuprofen and acetaminophen aren't just enough. And so on a lot of my patients, I also prescribe a corticosteroid. So dexamethasone in Canada is very popular. In the States, I know you guys do Medrol dose packs.
Yeah, the Medrol.
Yeah,
Hmm.
but in Canada, we don't give very too many Medrol dose packs out. We're more dexamethasone people comparison to the Medrol dose
But
pack
isn't the
people.
dexamethasone what you give for kids who are like wheezing?
I don't use it
Or like
for
croup,
that purpose.
like people are
Uh,
like kids who have croup. So I'm in
well,
like a totally different, like,
yeah,
I'm
totally.
treating like little littles, so
Yeah,
it's kind
no,
of
and I'm
like
not seeing them for that. No, I'm using it as a way to decrease inflammation. And
inflammation.
yeah,
Okay.
so usually I always tell my patients they're like your little magic pills.
Okay.
Okay. And I'll give 4 milligrams BID for 3 days.
Okay.
And I see a dramatic reduction in
Hmm.
inflammation and
Pain.
swelling and
Okay.
pain, totally.
Well,
And
how about like organic, like supplements?
int-
Are you
yeah,
offering that at all, or
You know,
it's just not enough?
I don't know. I don't want to say I'm an expert in naturopathy or
Hmm.
pretend to be an
Hmm.
expert. Usually, if patients are having a tough problem with their wisdom teeth, and I'm in the same camp as you, like you're trying to figure out what are you doing? Are you eating enough food? Some patients will call and say that they're throwing up. And especially on like day 3, day 4, and I'll be like, well, when was the last time you ate? And they'll say, 2 days ago. And I'm like, well, of course, you can't take pills on an
Yeah, an
empty
empty
stomach, right?
stomach. Yeah.
Yeah. So the next step up I like to do is maybe ketorolac or Toradol.
Toradol. Okay.
Yeah, yeah. So that may be, but remember, you can't. They're both Toradol and ibuprofen are both NSAIDs, so you
Mm-hmm.
can't take both at the same time. So then I
Mm-hmm.
would say, maybe we can try Toradol. I
Mm-hmm.
know some dentists they'll maybe consider Tramiset. Tramiset is Tylenol with
Mm-hmm.
tramadol.
Mm-hmm.
T3s I
I
find
feel
don't
like
do
I'm in the
anything.
OR.
Yeah.
I'm like, okay, are we pushing these through an IV?
I mean, I
Okay.
do, but
You do. Yeah, that's
I
what I was
do,
like,
yeah.
huh, okay.
No, no, but no, I just want everyone to know that there are options. Patients
Mm-hmm.
are going to be in pain, but in my opinion, Grace, if you want to know the secret to reducing pain and reducing swelling, it's getting good at taking out teeth. And it's not making like massive flaps where you have to drill all the bone away. It's not about getting teeth out as fast as possible.
Mm-hmm.
It's about not tearing the periosteum. It's about
Mm-hmm.
having clean flaps. It's about having
Mm-hmm.
clean surgery. It's about
Mm-hmm.
having proper closure where like tissue is sutured to like tissue. It's
Mm-hmm.
about being, yes, you want to be efficient, but it's about being clean with your surgery.
Mm-hmm.
Random bone removal is unnecessary. Tearing of periosteum as you pull on your flap with your Minnesota retractor, unnecessary, right? It's respecting the biology. And
Sure.
and for me, that's really helped so much is
Hmm.
just not being in a rush. I
So,
find everyone's just in a rush these days.
so I mean, so like respecting the anatomy,
Yeah.
using taking your time, not like making a mess out of it, right? Like
Yeah.
keeping the field clean, doing clean surgery. What are some tools that are using, like laser, hand pieces, like besides an elevator and a forceps, like what
Yeah.
is the armamentarium?
So you bring up a great point there. Yes, my main retractor is a Minnesota retractor. My favorite elevator if you want to call it, is a 3 millimeter luxator. I've designed my own. I
Oh,
love it. I have fun with dentistry, right? But
yeah.
a huge component of this is having a proper drill. So many dentists are using air-driven handpieces, and
Hmm.
air-driven handpieces chatter, and they take forever to cut through a tooth. I use my favorite handpiece is the NSK Z45L, which is a 45-degree angled electric handpiece. I really feel electric is a million times superior to air.
Hmm.
I
Hmm.
refuse. If you gave me an air-driven handpiece, I wouldn't come to work that day.
Mm,
I'd be like, man, this is gonna take me forever to cut through this tooth, and it's gonna chatter. And when it
mm,
chatters
mm,
and it cuts against the bone, it's chattering
hmm.
against the bone. Those aren't clean, smooth edges
Mm.
anymore, right?
So we're talking like Porsche and like a Lexus.
I mean, I drive a Lexus. What are you saying, man? Damn, Grace.
I was just thinking of it like a,
Grace, man. Man,
like
that cut deep.
I'm sorry. I was just
Ouch.
thinking, okay, what is some
Here
like
I
it's from
thought I made it by getting a Lexus, and now you
no,
just threw me in the garbage, man. Oh God.
whatever.
Oh,
You
here
have
we
some
go.
hidden no, you have some hidden sports car at your house. I
No
just
way,
know it.
man. Dude, I'm the simplest dude. My fanciest flex is my Garmin watch. And so,
Okay. I need to talk to your wife. Okay, well then let's back it up because I'm
yeah,
thinking
thanks, Grace.
armamentarium, right? Like because you're talking as if this electric handpiece is like the top elite machine.
You can't compare. You really can't compare. You need an electric handpiece. If you're going to be doing dentistry in 2026, you better have an electric handpiece.
Okay.
It makes
Okay.
your life so much easier. The amount of torque you have in an electric handpiece, the ability
Okay.
to cut through a tooth in mere seconds. It's all
Okay.
about efficiency, it's all about power, and it's all about having cleaner margins. So whether you're
Okay.
doing prosthodontic work, whether you're doing pediatric work, or whether you're doing oral surgery, you need clean margins. And I really feel with having a smooth drill gives you
Hmm.
exactly what you need.
Okay. Got it. So then do you have one in each operatory?
Absolutely. Yeah. So
Hmm.
we grew our practice. Okay. We started off with 6 chairs when we bought it in 2009. I think we're at 24 ops right now in
Okay.
2026, and every op has a surgical handpiece. It's so easy to do. You can get like a converter for
Hmm.
your air unit, and it literally sits underneath your unit and it converts your air to electric. And it's so inexpensive.
Hmm.
And you can now have an electric handpiece in your operatory. I find that the electric handpieces last so much longer than air-driven
Hmm.
handpieces. I'm very rarely sending them in for
That's
repair.
great.
Yeah, they don't get like they used to be back in the day. They used to be really heavy. Now they're not. Like they're awesome handpieces. And
That's
it's
well,
it's in all my ops for sure.
so it's in a good investment and keeps your procedures nice and clean,
Yeah,
which contributes to less pain for the patient.
totally.
And but like going back to, controlling pain and all the steps that you're taking, like you're taking preventative measures to keep everything, like to keep the procedure on
Totally.
point.
Yeah.
What other steps can we take as clinicians to reduce the risk of dry sockets and other post-op complications?
I love it. The number one thing, like I alluded to earlier, PRF, platelet-rich fibrin, you have a
Mhm.
96% reduction in dry sockets. Without a doubt, that's been a huge game changer for me. A lot of people, they say dry sockets, if you're a smoker, you're going to get a dry socket.
Mm.
I don't see
Like
that.
suction in the mouth type of thing.
Yeah, like,
Yeah.
people may say, sucking through a straw will give you dry socket. I honestly, I don't see I don't see the whole smoking dry socket correlation. I may be
Okay.
an outlier that says that, but I don't believe
Mhm.
in that. I work in a small town working community and a lot of people smoke
Yeah.
and I don't see dry sockets that much.
Okay.
I really feel dry sockets come from crappy
Hmm.
extractions. When a
Hmm.
tooth takes an hour and a half to come out and you're pulling on that
Hmm.
tissue and you're drilling on that bone and you're
Yeah.
putting pressure and you're creating so much inflammation, that's when you see dry sockets. And when I look back on my career, all my really crappy extractions that, you wonder why you came into work that day and you wonder if you really deserve that degree on your wall because that
Oh,
extraction went so bad.
yeah.
Those are the patients that end up with a dry socket. So I
Okay.
really think dry sockets come from inflammation. They come from
Yep.
really difficult extractions. They don't
Hmm.
necessarily come from smoking. You
Hmm.
may see it on some females on birth control,
Hmm.
just because you see a dissolution of a blood clot, not just the act of the medication.
Hmm.
But I don't see it in smokers that much. I see it more on
Hmm.
really difficult extractions.
Okay. So, I mean, I know you gave us a whole lot of information, and I wanted to kind of ask some other questions about the blood draw and the fibrin and the clotting. Are there patients that are contraindicated for this?
Yes, absolutely. So, some religious people, particularly Jehovah's Witnesses,
Oh, okay.
they they are cool with you taking blood, but
Hmm.
you can't put that blood back in them.
Really?
Yeah.
Oh,
Yeah. So Jehovah's Witness, you like I'll have
okay.
people say like, it's against my religious belief.
Okay.
And that's cool. Some patients don't want you to take their blood. They say, I'm so scared of needles. You're lucky I'm even sitting in your chair there, dude. Let alone
Okay.
you're going to come at me with a needle. Hey,
Right.
fair
Well, you're
enough.
in their mouth with the needle anyway.
I know, but to them it's different. So if they're sedated, then I'll just do it, right?
Okay.
You got to be careful. Patients that have had lymph nodes removed, maybe due to cancer therapy, you can't go to that arm to take blood.
Oh,
So if they've had a mastectomy and they've had, maybe
oh, yeah, yeah,
due to
yeah.
breast cancer, yeah, and they've had
Yep.
lymph nodes removed,
Yep.
you can't go to that arm to take blood because there's poor lymphatic drainage in that area.
Drainage.
Yeah.
Okay.
So it's a case by case basis. I always ask the patients, I say, this is my spiel is, and Grace, you know this, you're an experienced dentist. Your patients vibe off confidence,
Of course.
right?
Yeah.
If you're unsure whether you can do something, your
They'll
patients
know.
know just like
Yeah.
that. They're
Yeah.
like, nah, they read you. But if I walk into an op, I'm like, I don't know, I'm a pretty fun guy. So I was like, even if the patient's in their 70s, I'm like, yo, what's up? How you doing today? Hey, I want to make you heal faster. Have you ever heard of a dry socket? Yeah, I don't want you to get one of those. I'm going to be taking some blood from you. I'm going to put the blood in a machine that spins it down, and I'm going to take the growth factors from your blood and I'm going to put it into where I take your tooth out. I want you
Hmm.
to heal. That's why you came to see me, right? And everyone says, "Yep." I said, "All right, throw me out an arm here." And that's all I say. And I'd say 99.99% of the time, people are like, "Yeah, this is awesome. Let's do it."
Yeah.
I
Yeah.
don't
Like
see
you're
patients for post-ops or anything.
So like you're yeah, well, the way you deliver your message, you're getting consent, but
Absolutely.
it's not just like a written, obviously you get written consent, but
Yeah.
now you're putting them at ease and you're making them comfortable and then, you're explaining like what's in it for them, right? This is for them to heal better and faster and to heal comfortably. And I think that that's what everybody wants is to be comfortable after the procedure's over.
Absolutely, Grace. And Grace, that you bring up a really great point. And I know you're the same way in an op. You may not say, yo, what's up, but
You don't know
to
that. I mean, to my
maybe, I don't know.
teenagers, but I'm always like, what's on your phone? Who are you texting? Is that your girlfriend? Does your mom know you have a girlfriend? Like, oh, we're going to be talking about kissing and herpes real soon now. And they
Oh
get
God.
all red and it's so hilarious. And then which I'm going to ask you, see, remember I said I was going to ask you a bunch of questions like later on
Yeah,
in the show because we're going to go
let's
back to
go.
that because I need to ask you after this set of questions. So put this on your brain about Zen and vaping. Okay, so we're gonna go back.
Zins, hey? All right.
We're gonna go back to that. We're gonna go back to that. But we got to finish these questions. Okay.
I love it. I love
So
it.
we talked about all of that. Now the next thing we got to stay on task here. Even when we follow our best practices, complications can still happen,
Yeah.
right? So what are the most common things that happen? Like what are I guess most common complications that you see?
I like to separate out complications into a couple different categories. So like first category, before you pick up a pair of forceps, what complications can happen? A, your flap isn't big enough. You have poor access, poor visibility. Maybe that case is way above your head and you shouldn't be taking on this case in the first place. I
Mm,
look at all my complications and I look back and I'm like, all the memory, you never ever remember cases that go smooth. You only remember
yeah.
cases that go poorly, right? So
Yeah.
you look back and you're like, I shouldn't have done that. I shouldn't have done that. I don't even know why I took on this case. I let the patient talk me into doing this. And it turned out to be, my biggest stressor of the week. Why did I let my patients talk me into this? Just so
Hmm.
that they don't have to, like, they can save money or they don't have to go see someone else, right? And so that's like before you pick up a pair of forceps, those are the things that I'm looking at. Okay. Your flap isn't big enough. You have poor access and visibility in oral surgery or in anything in dentistry. If you don't have access and visibility, what the heck are you doing? You got to stop, right?
Hmm.
And then we have during the surgery, maybe excessive intraoperative bleeding. Maybe you're drilling and you're drilling a little too far, and maybe you hit an accessory vessel and it starts bleeding. Or you're taking out a tooth and all of a sudden you see this big black hole. You're taking out an upper first molar and you see this big black hole,
Ooh,
the sinus. And
sinus.
now you're like, now what do I do?
Yeah.
And then you start, you're trying to dig around the roots there and boop, there goes a root right in the sinus. You're like,
Hmm.
oh shit, this is gonna be a bad day.
Yeah.
Right? But
Yeah.
I can't say it's not. It hasn't. Of course, it happens, and I don't want it to happen. Grace, did you know the very first tooth I took out in 2009 as a dentist? The very first one, the first. I think it was my second day of work. I pushed a root in the sinus. The
Were you
very
freaking out?
yeah,
Yeah.
and I was
You're like
like, man,
sweating.
why
Yeah.
why this is my career now? Like
Yeah.
like you've been given this
Yeah.
license to drive and
And
yet you don't even
now,
know where the gas pedal is, right? Like dental school
so
teaches
what
you just to
happened? What did you do?
I had to call an oral surgeon and thank God I just graduated so they still remembered me. And yeah,
Oh,
no, it's dental school teaches you just enough not to kill someone.
oh
It
yeah.
doesn't
That's
teach you
so
much more
true.
after that, right? And
That is
that's where
so
we fail
true.
our students these days.
Yeah, and that's true. But although I have to say some students, I said this on my Instagram. I said to those doctors who have their own businesses, I'm like, you know what, to be honest, in my opinion, the best associate to hire is one at least 3 years out because they've done all the
Absolutely.
mistakes somewhere else. And I'm
Yeah.
like, they're ready to go. But I
Yeah.
mean, but I'm not saying that new people aren't good because I've had
No,
plenty of associates that are great out of school. But I'm just saying that like the sweet spot seems to be 3 years out. But I'm digressing. I'm
no doubt.
digressing. So then
I
if
like these
you're
digressions.
I know. Well, that's what makes this podcast interesting. And I swear, like, people will message me, like, that was so funny, or this was so interesting, or I resonated with that piece.
Yeah.
But when, you have these contributing factors and you're trying to do your best to make everything better, right? When that kind of oh crap moment happens, like, what do you say to your patients?
You know, everything's about pattern recognition. You're a pediatric dentist. If I tried to do pulp standstill crowns on in Canada we call them D's and E's. I don't know what you guys call them in the States. You guys have other letters, but fours and fives on younger kids. I wouldn't know what to do if I couldn't get the D on. I'd probably pull the D so I can get the cap on the E, right? And I wouldn't know what to do. But you've seen it so many times that you're like, well, of course, Nekky, this is you just got to remove it here, plop, plop, in 10 seconds. It's the same for me. Okay. It's pattern recognition. Once you've seen it before,
Mm-hmm.
you have this sense of confidence that you know what to do and you can be calm about the situation. So when you're saying, what do you tell the patients? It's you say, listen, this is what's going on. I'm going to take care of you. That's all patients want to hear.
Yep.
Patients want to know that they're seeing the right person. Complications are going to happen. I always take my time before I start, and I always show the patient the black line on the X-ray, that
Mm-hmm.
channel, that mandibular canal that's
Canal.
crossing their
Hmm.
third molar. Do
Yeah.
you see this black line here? Do you see that tooth? Tell me the position of this tooth in relation to this black line. And they say, well, it's touching. And I say, listen, I didn't put the tooth there. You didn't put the tooth there, but here we are. What should we do? Right. And you just have to explain to the patient these are the things that can happen. And they may happen, they may not happen, but we're in this together. Right. And when you don't tell a patient something can happen, that's when they're mad at you. So
Right.
patients do much better with explanations than they do with excuses. I
Right.
always tell my dentist, take your time to explain everything that can go wrong prior to the surgery
Mm,
so that when everything goes so smooth, they're the first one to give you a high five. Or if they do come like upon a complication, they say, you did warn me about that. Right? Patients do
absolutely.
better with
Yep.
explanations than they do with
Yep.
excuses. Never give your patient an excuse. Okay. I'm so fortunate. Year, I graduated 2009. So I'm year 17. I've yet to go through a lawsuit because I really take my time to show patients, listen, like patients do better with explanations, not excuses after the fact. Take your time to
Yep.
explain what you're doing.
No, absolutely. Set expectations right up front and
Absolutely.
make sure
Yeah.
you're educating them. And that's part of building your communication skills. I think for doctors, you have to improve communication skills and the way you tell your patients so that
Yeah.
it's registering, right? Now, as that comes with experience and time, and you're also you also have to improve your surgical confidence, right? So for doctors who want to perform surgery, what are practical steps that they can take to get better at surgical extractions over time?
Totally. Grace, before we dive into that, I have to ask you,
Yes.
don't you think what separates you from a lot of other people, it's not how good of a dentist you are. The patients don't know how good of a dentist you are. They
No.
don't care what you did in dental school. They don't care
Yeah,
where you went to dental school. They don't care what size of burr you're using, but they do care how you talk to them. And
absolutely.
I find as I've grown older or more mature, I can't say my hand skills are getting better, right? Like I
Oh,
feel
I'm
like
sure they are.
I'm a robot at this point. Like I
Yeah.
know where to section.
Yeah.
I know, of course, I'm getting more efficient, right?
Yeah.
But what improves every year is my communication. And that's
I
what sets me apart. And Grace, that's what sets you apart too. Every year you learn to communicate a little bit better.
absolutely.
And I wish they took a whole year in dental school. This is how you talk to
Yeah.
someone. This is how you talk to your patients, but more importantly, this is how you
Yeah.
talk to your partner at home, right?
Absolutely. And
Communication falls into everything.
communication.
Yeah,
Every
it's the most important thing.
Oh, I'm glad you're highlighting that because there is research that shows there's papers on it on doctors, not just dentists, that don't get sued. And it's people who get sued, healthcare workers, are basically when patients feel disregarded
Yeah.
or when patients feel slighted. That's when they're going to come after you with because they feel wronged, right?
Yeah.
But they're not going to sue someone they like,
No.
right? So if you are likable, you read the room, and every patient, you've seen thousands, right? Every patient has a different personality. And so if you can read the room, read the patient and meet them where they are and treat it's not a one size fits all. So you can't memorize some script, right, to greet each patient, right? And that's why they say in your notes, put in something that you're gonna remember that Mrs.
Yeah.
Jones has twins that are in high school. You can talk about that, right? Like you need something, right, to make sure you build a connection. And that's what we talk about as rapport, building rapport. But it's not building rapport the same exact way with same exact person because Nekky, you're going to have a patient that's like brave and not scared. Do whatever you want, doc. I trust you 100%. And they're just sitting there watching TV, right? Then the other patient is like, what is that? What is that? What tool is it? What
Yep.
right?
Oh,
So
totally.
you're right in that we learn we have to.
Yeah. And also in dentistry, the patient that you're talking to is not always the person that you see. And what I mean
Tell
by that,
Yeah, keep going.
yeah, because in dentistry, people are scared.
Mhm.
It's a very intimate field you're entering, right? You're getting very close to some people, and some people don't like that.
Yeah.
Some people are scared of the dentist. They've had past experiences. A lot
Yeah.
of people are scared of the dentist. And
100%.
the person that you're talking to is not always person that you see, because
Mm-hmm.
you're talking to fear, and you're talking
Mm-hmm.
to someone who may be irrational in the moment. You may be
Yep.
talking to someone who just lost their mother. You may be
Yep.
talking to someone who's had severe dental trauma. You may be talking to someone who's been abused.
Yeah.
And by you entering into this intimate space with them, you're now entering into a different category for
Yeah.
that patient. And they may be snarky, and they may
Yeah.
be uptight, and they may be aggressive. That's not the person who they really are, though. And dentistry can bring out a lot of different facets amongst people that they didn't even know that they had. And so
Right.
it's up to us as dentists to take a step back. And I used to get so frustrated when patients would be like, I hate the dentist. And I'd be sitting right here, be like, what do you mean you hate me? You literally just met me. You know what I mean? And so I break the ice every single way. And I know a lot of other dentists can't do this. I know this is just my personality, but when people say I hate the dentist, I say I hate the patients. And then we both start laughing, right? And so you're like, okay, what's the real problem here? And then they divulge to you what's going on, right? And so I
Yeah.
think as dentists, we need to take a step back, because a lot of our patients aren't going to be nice because they've had trauma, and
Right.
that's legit. Like, you'll have patients that haven't been to the dentist in 20 years because of trauma that they've had, and they have abscess teeth, and they'd rather go through the pain of having all these abscess teeth than rather
Mhm.
sit in that chair. And it's up to us to be able to look past that and to
Yep.
be able to make that connection, Grace. Exactly what you said. Dentistry isn't about teeth. Dentistry is about connection and
Yep.
communication. And I wish someone would have told me that when I was a kid, right? Like, or
A
a younger
hundred percent.
dentist.
A hundred
As
percent.
yeah,
You
as
know?
an older person now, I want to know I can talk to patients.
Right. What would you tell your style, it's like kind of like what would you teach a younger dentist that's within 5 years out? This is like one of
Absolutely.
the key
Yeah.
components, you
Learn
know?
to talk to people, and not even your patients. Learn to talk to your partner at home. Understand that what you're fighting about is not what you're fighting about,
Mm,
right? What you're fighting about is the disregard for
mm-hmm,
something that happened 2 weeks ago,
mm,
right? It's learning to listen, learning to say yes and not yes but, right? You don't need to argue about
100%.
everything, and your patients are going to test you. Some of them, like that nitpicky one, they'll say, but what about this? What about this?
Mm-hmm.
You did this. And I still
Yeah.
remember a patient told me to hurry up with a filling one day, and I was like, okay. And I got everything done. And then she came back 2 weeks later and she said, you were rushing so much. You did this. All you wanted to do was make money and get me out of here as
Oh,
fast as
that's
possible. And I was like,
terrible.
you told me to hurry up. And now you're getting chicken stuck between your teeth. And now you're mad at me. Right. But
Oh, that
like
happens.
it happens. Right. But
It happens.
it is learning to talk to people. And I wish I could push away my younger dentist ego,
Yes, I
right? Because
know.
ego gets us into
Well,
so much trouble, right?
it's not just ego, but sometimes it's fear.
It is
I
fear.
think
Yeah.
as a younger dentist,
Yeah.
sometimes you're afraid of your patient, right? Like
Yeah.
you're
What are they going to
afraid,
think of me? Yeah.
right? Or they're going to write a bad review, or
Yeah.
they're going to, but I think, like you said, with experience, right? Like the dentist now, you would say to that patient, well, if I rush, I'm going to do a bad job. Is that what you want?
Yeah. Totally.
Right? You learn to push
Right.
back a little bit, but not push as in challenge, but you explain, right? You have to say like, well, I can hurry up, sure, but then I'm not going to do the best work,
Yeah.
right?
And also, Grace, not everyone has to be your patient.
100%.
Right?
A
I
hundred
used to try to
percent.
sell things to people like, you need a root canal. You know what a root canal is? You need this, you need this, you
Yeah.
need this. And I'm the guy for you. And now I find myself so many times saying, you know what? I've done this before, but I don't do it every day. You need to see this person here. And I do this there all day,
Yeah.
every day. But
Right.
you know what?
Yeah.
I'm not your dentist. I
Yeah.
don't want to be that guy because I don't want to deal with this clash that we may have.
Right.
It's not every patient has to be your patient, and that's okay.
No, that is tremendous. I mean, we could do a whole nother podcast just on communication
Yeah.
and, like communicating with other dentists if you have mutual patients, right? Like, how does that work? And like, there's all kinds of scenarios and examples that I think we could definitely discuss
Oh,
about.
goodness grace.
This could go
Yeah.
on for another like 2 hours, but
Let's let it. I'm
we're
just
gonna
kidding.
no, oh yeah, no. Our listeners are gonna be like, "Hey, I'm done working out." See, I get messages from my listeners. They're like,
Oh, yeah.
"Grace, my workout is 30 minutes and you went longer." And so I had to stay on the elliptical machine 20 more minutes.
Man, that's good. That's
And
good.
I was
That's what
like,
we
"Hey,
all need.
that's good for your health."
Yeah.
Um, but anyway, the one like I wanted to go back to Zen real quick. Zen
Yeah.
and because, and I'm only bringing this up because it came up in topic with our group. And I mean, I heard about Zen and vaping, like, it's been around, right?
Yeah.
But what are you seeing in your practice with patients who are using that kind of stuff?
So many younger kids. I'd say my younger kids is different than your younger kids. So like I'll see like 16-year-olds using Zins. Have you ever tried a Zin, Grace?
No, I've only seen it like at the gas
Oh,
station, but
man,
I've
I
never,
tried one and I
yeah.
puked everywhere.
Oh,
Like it's strong stuff. I remember
really?
trying, I always like to try everything, right? Like you if your patients are using it,
You got
I,
to see
I,
what it's about. Yeah.
oh, totally.
Yeah.
Man, I'm like, to one of my patients, like, hey, give me one of those. Let me try one. And I puked and I was like, this is disgusting.
Oh my
How can you
God.
guys use this? And they're like, yeah, we just feel this little high off of it. It feels good. And so they're substituting. It went from smoking cigarettes when we were
Right.
kids, Grace,
Right.
and
Right.
now I don't see too many younger people smoking cigarettes. And
No.
then it was vaping, and
Right.
then a lot of people were vaping, and then now it's into nicotine pouches.
Yeah.
And I see it. I tell people, and you'll see, the corrugation in people's mouths of where they hold the Zins.
Yeah.
I'll always say, like, listen, man, we don't want these toxic properties around an extraction site. I want you to heal well. I don't
Yeah.
want you to have problems. Stop doing that crap, man. And like, what are you doing this for? And so I they're not going to listen to us. But I
Right.
always like to inform them and say,
Yeah.
this isn't the best for your health. But I'm also not here to scold them either. They're going to make a
Right.
decision no matter what. I've never believed in negative reinforcement. It's not going to, they're just going to hate you. They're not going to
Right.
like,
Right. They're just
yeah.
blow you off
So
anyway.
yeah, all
Yeah.
I say is like, man, you're too old for this crap, man. What are you doing? And then we kind of just laugh about it. And I'm like, in all serious though, legit, keep that crap out of your mouth when I pull your
Yeah.
wisdom teeth. And they're like, yeah, no problem. I got you. In Canada, marijuana is legal.
Oh yeah,
And
I
so,
smelled it everywhere in Whistler. I was
oh,
walking around.
Whistler's
I
bad
was
for it,
like,
man.
I
Man,
smell it
jeez.
everywhere.
Yeah, and
Yeah.
you're like, yeah, this is Canada now. So, yes, definitely Whistler. You'll smell it there. On kids, and you'll be shocked. I'm shocked. I know I say I've tried everything. I'm a good boy at heart. I've never smoked weed before, but I have a lot of patients that say, I need it to sleep, and I'm like, so you smoke weed
Really?
every day, and they're like, yeah.
Huh.
And they're so difficult to sedate. My goodness grace. They take so much drug. Yeah,
Really?
oh yeah. And I always tell them, okay, instead of smoking, can we switch to edibles for a bit? And they
Yeah.
all say, yes, of course, I'll do an edible instead. But I was shocked, like blown away by how many
Huh.
teenagers, like I'm talking
Yeah.
16-year-olds, smoke every day just so that they can sleep. And
Huh.
I feel bad for them because
Yeah,
that
that's
that's pretty
terrible.
bad. Yeah.
Do you think it could be correlated to social media and like devices and stuff?
I think that increases anxiety across the board, and I think that's
Yeah.
what they're suffering from. You've seen it too, Grace. How many younger people do you see on antidepressants and anti-anxiety medication? And I don't know what it's like where you are, or smoking marijuana
I
all
haven't
the
seen
time.
that population. I'm still treating like 5-year-olds and
Oh, well,
6-year-olds.
hopefully they're not on those
So I'm
anti-anxiety
like,
pills,
yeah, we're not
but
there yet.
I see them and they're so difficult to sedate, especially because they're on benzodiazepines all the time. And what am I giving them to sedate them?
Yeah.
A
A benzo.
benzodiazepine, right?
Yeah.
And so it's
It's hard.
difficult sometimes, and I feel bad for this generation. Of course, I'm addicted to Instagram, and I'm sure you are too. But
Oh
like, I
yeah.
have the ability to delete the app and go for a
Sure.
run, right?
Well,
Like
yeah, like,
we have that mental
yeah.
ability to do that, but I don't think a lot of the younger population
Right.
does because it's
Right.
so addicted to their
Right.
neur neurology, right? Like their
Well,
dopamine hits are constant all the time from their likes.
I read something about how kids under 16, if they have access to it or if they're using it too much, um, if you take it away, they get withdrawal symptoms and they go
Yeah.
into like rage, like
Yep.
legit
Yep.
rage. And I'm like, that is so interesting, to think that that's what's causing the like the brain, right, function and addiction. So, I mean, again, a topic for another day. So, I'm going to come to a close here and I'm going to ask my final
Grace, this
parting
is this is too
question.
much fun.
I know.
I'm loving this, man.
I
This is great.
know that, and that's why I was just like, you'll have to come back as another podcast episode, and we will produce it. Like, we'll have all these interesting questions, and of course, we can go off the cuff and everything. But you just have so much information to give and provide. It's just so much fun, and I'm like, oh, my listeners are probably going to all be on your Instagram handle the minute we get off. So please tell all of our listeners what is your number one piece of advice on what you do to find balance between your professional and personal life and maybe digital detox.
I love it. I am addicted to Instagram. It's Dr. Nekky Jamal.
Okay, everybody.
But um, I'm honestly, I'm 42 right now on my 40th birthday. On February 14th, I just turned 42. On
Oh
my
my
four,
goodness,
yeah.
happy
Oh, thank
birthday.
you,
You're
man.
born on Valentine's
I was, yeah.
Day.
Yeah, yeah. But I was 42. I looked in the mirror
Yeah.
and I said, I don't like the guy I see.
Why?
And I just, you're not comfortable in your own
So,
skin, right? And so I started this journey of like, I need to be accountable to myself. And I went down this journey of discipline and consistency.
mm,
And I eat the same thing every day. I work out every day. I have a trainer. I really feel it's changed my life.
good for you.
Like being active, like I've always been a runner. But I feel like I'm not defined as a dentist anymore. Like in my own head,
I love that.
it's like I used to let my profession dictate my identity. And
Yeah.
so if, Grace, so many of us dentists are like that, right? Like if you take
hmm
away our dentist title, who are we? Right.
hmm
And we going through this
hmm
deep depression. Whereas now I can confidently say like, hey, I'm Nekky. And when people say, what do you do? And I say, I'm a runner. You know what
Oh,
I
that's
mean?
nice. Are
Yeah.
you?
And
Yeah, really? I was gonna be like, oh yeah, I take teeth out.
yeah, no. And then they're like, "That's your job," and I'm like, I pull wisdom teeth too, but that's more fun. Let's talk about running." And so I like to my passion and my focus and maintaining that professional personal life has been just eating super clean and like trying to like be the best version of me. And I don't biohack, I don't do vitamins and all that crap. I honestly just want to be consistent and have this discipline to myself to look in the mirror and be like, you're going to do something hard today.
Good
And
for
I
you.
love that. I just love being able to like tell myself it's
That's
4:30 a.m. Wake your
wonderful.
ass up. You know what I mean? I
Wow, look
love
at
it. Like
you.
that's just me. I
That's
feed off of that and it's me versus me. I don't care what anyone else
I
does.
love that. That's wonderful. And for you know what, for the community that's listening, our community, our our kind of like tagline is we can do hard things.
Yeah.
And I just turned 50 in January.
What? Grace,
Yeah,
yeah, great.
thank
There's
you.
no
But
way. There's no way.
oh yeah, but you know what? Like you, I had this whole epiphany of taking care of myself, eating right. I worked out
Yeah.
with my trainer today. But then when you get
Heck
to
yeah.
50, now I'm looking up biohacking because my legs aren't doing the half marathon or anything like that. Although I have to say my mom ran marathons until she was like 65.
Really?
But oh yeah,
It's
but
wicked.
but I'm just gonna say to the listeners, I love what you just said, Nikki, is that you don't let dentistry define you. You have this whole life outside. And yes, you happen to be a dentist, right?
Yeah.
And yes, you serve people with your talents. As dentist, you are a healer. You have hands of a healer. That is a gift. Not everyone can do your job. I certainly can't. Yes, I'm your fellow colleague and dentist, but I really don't have interest in doing what you do, to be honest.
Vice versa, Grace.
Just like you don't want to do what I do, right? But we're still
Absolutely.
dentists, right?
Yeah.
So I'm just saying, everyone who's listening, everyone here has a gift. And it's
Yeah.
about finding your gift, but also the true happiness comes from the ability to understand the concept of you get to wake up this morning. You get to
Yeah.
run. You get to,
Yeah.
because without your health, if you
That's
don't
all
make
we got.
time for your wellness, you're going to make time for your illness. And if you have to make time for your illness, you can't be in your dental practice. So
That's right.
that's where we are.
Let's go, baby. That was
Let's
awesome,
go.
Grace. That was
Let's
good.
go. See, now, Nikki,
That was a
you're
good
going to have to
finale.
be, now you are like adopted into the mommy dentist community.
Oh, nice.
And now we're going to teach you LFG, which you already know. So we're not going to curse on our podcast,
Okay, okay.
but you know what that means. So, all right, I'm going to let you go, but everyone follow Dr. Nekky Jamal, Nekkyyjamal on Instagram. Be his friend. Follow him. You know, he's got great advice. He'll have to come back for another session on our show. And also, I think Nikki, don't you have some kind of program about online program?
Yeah, so I teach dentists how to extract teeth. I my online course is Third Molars Online. It's just a wisdom tooth extraction course. It's in 35 countries across the world. It's awesome. And then
Okay.
my in-person course is theextractioncourse.com. And
Okay.
it's mainly in Canada, but we get people from all over the world coming too. But
Perfect.
yeah.
Well, there you have it, everyone. If you want to sharpen up your skills, go check it out. Thank you for listening, and we will see you next time. Take care, everybody.